On December 22nd, Fargo Cass Public Health started administering COVID-19 vaccine to our area first responders and frontline healthcare workers. Based on our limited allocations and supply at the time, it took us about a month to get through that group. On January 18th, we began administering vaccine to older residents and those with high-risk medical conditions. As the North Dakota Department of Health announced new priority groups were eligible to receive vaccine, we adjusted our communications and vaccine operation accordingly. In early February, we were invited to relocate our vaccine operation to the former Gordman's building and shared that space with both Sanford and Essentia Health. In late April, we were able to move our vaccine operation to our main location, which has allowed us to begin the process of integrating COVID-19 vaccine administration into the other services we provide to the community.
We continue to encourage members of the community to get vaccinated against COVID-19. It's one of the best tools that we have to fight this pandemic. It gives us the power to protect ourselves, those we love, and members of the community. The FDA Emergency Use Authorization has 3 vaccines currently available for COVID. Moderna and Pfizer are both a 2-dose series with a specific amount of time between each dose. Moderna is authorized for individuals 18 and older. Pfizer is now authorized for individuals 12 and older. The Johnson & Johnson or Janssen vaccine is the only single-dose vaccine at this time, and it's authorized for individuals 18 and older. And individuals are considered fully vaccinated 2 weeks after either their second dose with Pfizer or Moderna, or 2 weeks after their dose of Johnson & Johnson. COVID-19 vaccines are similar to other vaccines. There may be side effects after vaccination. The side effects are normal signs that your body is building protection against the virus, and these are actually good things to see because then we know our body is doing what it needs to do to protect us. Side effects that you may experience could include muscle soreness at the injection site. You may have a headache, feel fatigued, you may have chills, but typically over-the-counter pain relievers can be taken to help you feel better and relieve these symptoms you may have. We provide COVID-19 vaccine at our main building, which is located at 1240 25th Street South in Fargo, or you can call 701-241-1360 or visit our website for details.
WIC is the Women, Infants, and Children Nutrition Program. WIC is the most successful public health nutrition program in history. What studies have shown that women who are on WIC have better pregnancy outcomes, they have larger birth weight babies, their kids that are on are better immunized, and they have got better cognitive and vocabulary recall at age 4. So WIC really makes a difference for those moms and those families. The goal is to break the cycle of poverty for those moms with good nutrition. One of the parts that makes WIC successful is that one of the studies has shown every dollar spent on feeding a pregnant mom saves up to $4.50 in medical costs for that mom. That's tallied up from reducing premature births, having fewer low birth weight babies. So WIC provides food for families, it provides nutrition education, and it provides community support for families that have got a pregnant mom, a mom that's had a baby in the last few months, children up to age 5. Our WIC nutritionists see about 50 families every day, and they provide a unique set of targeted services to help families give their children a healthy start. We have a community of nutritionists and a lactation consultant ready to listen, to share information, and provide guidance and moral support. So WIC is about more than just food. We're able to empower parents and caregivers by helping them get the tools to raise happy and healthy kids. If you're interested in applying for WIC, please call the office at 701-277-1455.
So last fall, when planning for COVID, we were able to repurpose the building so that we had a space for quarantine isolation for individuals who have nowhere else to go. The whole point of the Downtown Engagement Center is really to try to get everybody connected so we can get them out of homelessness and into homes. I think when it comes to housing and my role here at the center, it has been very helpful to be able to have just a place, anybody, whether they're accessing shelter services or not, to be able to come in so that we can connect with them. It's so much easier to have them on site so that we can try to work on getting their ID and social security cards and then fill out the housing applications and get them submitted so they can move into homes of their own.
The Gladys Ray Shelter serves unaccompanied adults within the FM area who have no other options for shelter. The Engagement Center expands that reach a little bit to provide anybody that might be homeless within the FM area with those basic needs or just that place for respite. Engagement Center is a real opportunity. Central to that is our location. We are in the heart of downtown Fargo. That is where our people are. That is where they end up first when they come to town. That is where they circle back to, no matter how long they've been in town. It is important that we can reach people where they truly are at. That is more than just a statement of what we stand for and how we reach people. We are physically actually able to reach them where they're at. So the Downtown Engagement Center is really just a place filled with those amenities and those basic needs items that a lot of people take for granted. So we have showers for our guests or for somebody that needs them that might be staying outside. We have laundry facilities as well as a phone.
So the benefits of the Engagement Center is that people have a place to go and connect with resources. And also it helps that they get to create that relationship with us. They just stop by sometimes, they just want to talk to somebody, talk about their situation, where they want to head to, whether they want to go to treatment, or whether they want to apply for housing. So it really just helps to have a place to go and to talk to somebody, to help them move forward in life.